Dr. Charles Gardner, Medical Officer of the Simcoe, Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe, Muskoka. So as of today, we have a total of 11,446 cases. This is up by 348 cases a week ago when I last reported. And this actually is a 24% reduction over the week compared with the week before it. So if we look at the week going from May the 9th to the 15th, we had 338 cases, whereas the week before that, we had 444 cases. And this is very close to the provincial experience where the province as a whole had a 21% reduction over that period of time. The drop happened primarily in Simcoe County, a 24% reduction in the cases in Simcoe County, with stabilization in Muskoka, 17 cases that occurred during the week of May 9th to 15th, which is the same as what it had been the week before. Simcoe County had 332 cases during the week of May 9th to 15th. So certainly we've had a week-on-week reduction of cases dating back to the week of April the 11th, at which point we had 717 cases. So we've had a 53% reduction over a 5-week period in our weekly case count. And our active cases also decline. We now have 767 cases, down from 927 cases a week ago. And our total number of people who passed away is 241, which is up by 8 cases, 8 deaths over the preceding week. And I would like to express my condolences to the family members for your loss. So these people consist of the following individuals: a man 80 or more years of age, a woman 80 or more years of age, both from Simcoe County, a man 45 to 64 years of age from Simcoe County, a woman 65 to 79 years of age from Simcoe County, a man 65 to 79 years of age from Simcoe County, a woman 80 or more years of age from Simcoe County, a man 65 to 79 years of age from Simcoe County, and a woman 65 to 79 years of age from Simcoe County. And 2 of these individuals had had a single dose of immunization given a greater length of time than 14 days between immunization and their passing away. So that's the first time that I've reported that kind of situation in one of my weekly reports. We certainly had some interest in the media about situations where individuals have been immunized and then become cases. And we are presently doing a review on our numbers. We have preliminary numbers, so we do want to be assured of their accuracy. But from a preliminary look at things, the incidence of individuals who've been immunized who then go on to become a case of COVID-19 is similar in Simcoe, Muskoka to the provincial experience based on the report that I've cited before a week ago, a report from Public Health Ontario that looked at that across the province and found that 0.06% of individuals who are immunized, either partially or completely, then have contracted COVID-19. So we're looking to be in a similar range. We have a reduction in the number of people living in Simcoe, Muskoka who are admitted to a hospital either here or elsewhere for COVID-19. It's down to 28 cases from 31 a week ago. The number in the intensive care unit is the same at 11 cases. And so we've certainly been trending downward since April the 22nd, when we had 66 cases in hospital. So for those that are presently admitted, their ages range from in their 20s to their 80s. 22 are sporadic cases and 6 are related to outbreaks. 10 of these 28 individuals are under the age of 60. So 1 is a person in their 20s, 4 are people in their 40s, and 1 of those 4 is in the intensive care unit. 5 are in their 50s, with 1 in the intensive care unit. We also have 12 individuals who are in their 60s who are admitted to hospital, and 8 of these 12 are in the intensive care unit. Over the weekend, we had 141 new cases. That averages 47 cases per day. And in the last 24 hours, we've had 42 cases. They include 41 sporadic cases and 1 case associated with a workplace outbreak. And this particular workplace is out of our jurisdiction in another health unit. 21 are male and 21 are female. 50% are under the age of 35, about 50% are under the age of 35. 39 are from Simcoe County and 3 are from Muskoka. 4 are community acquired. 24 are cases who had close contact with a known case. 1 is part of a workplace outbreak, and 13 are under investigation. 39 of these are self-isolating at home, or 2 are hospitalized, and 1 has recovered. So as always, the vast majority of our active cases have been in South Simcoe. And there we've seen a dramatic improvement in terms of the incidence of cases overall. So Bradford, West Gwillimbury has always had the highest incidence of cases per 100,000 population, but has come down substantially. So during the week of May 9th, they were down to 121 cases per 100,000 population for the week, which is down from 195 cases per 100,000 per week the preceding week. And over the last 4 weeks, their week-on-week case count has come down by 62%. Barrie is down to 78 cases per 100,000 population per week during the week of May 9th, which is down from 170 cases per 100,000 population the week before. So a very large decline. Over a 3-week period, a decline of 52%. Innisfil is down to 107 cases per 100,000 population per week during the week of May 9th, and as compared to 126 cases per 100,000 population per week during the week of May 2nd. And over a 3-week period, they had a 47% reduction in their week-on-week incidence. We do note that not all municipalities have necessarily come down in the same kind of way. There was some increase in the incidence in Orillia, which during the week of May the 9th had 50 cases per 100,000 population per week, compared with 30 cases per 100,000 per 100,000 population per week over the week of April the 27th, 3 weeks before. And the municipality of Clearview has remained stable over a 4-week period at 47 cases per 100,000 population per week during the week of May the 9th. So for Simcoe Muskoka as a whole, our incidence is 56 cases per 100,000 population per week, which is a reduction from 73 cases per 100,000 population per week the week before, and remains half of the provincial rate, which is 112 cases per 100,000 population per week. And that has been the experience of Simcoe Muskoka for pretty well the entirety of the pandemic, that we be at half the rate of the province and in the range of a quarter the rate of the municipalities to the south of us. Young people remain with the highest incidence, those between the ages of 18 and 34 having an incidence of 326 cases per 100,000 population per week. And we remain with the great majority of our COVID cases being variants of concern, 92% during the week of May 9th. And the great majority of those variants are B117 variants, but we are seeing an increase in the P1 variant, now at 87 cases, up from 76 the week before, and the B1351 variant now at 19, compared to 17 the week before. And we have now had a second case of the B1617 variant, the variant that is originating in India, and was designated by the World Health Organization on May 10th to be a variant of concern. Our second case has just come in, and we have it under investigation at this time. Our outbreaks remain the same at 12 outbreaks, which is the number that we had a week ago. So we've had some come to an end, and others that are new, leaving us at the same number. So in terms of our institutional outbreaks, we have one, down from 2 a week ago. So we had one declared over. In Simcoe County, we have no congregate setting outbreaks, down from 2 a week ago. So an outbreak in a shelter in Simcoe County and a group home in Simcoe County were both declared over. We have 10 workplace outbreaks, up from 7 a week ago. So we have 5 new ones and 3 that are declared over. So the new ones, 2 are in public administrative offices in Simcoe County, 1 a repair and maintenance facility in Simcoe County, 2 retail trade facilities in Simcoe County, and food beverage in Simcoe County. And declared over a manufacturing location in Simcoe County, food and beverage location in Simcoe County, and transportation and warehousing in Simcoe County. We have no community setting outbreaks, unchanged from a week ago, and we have 1 educational setting outbreak, down from 2 a week ago. And so of note, we have a new child care center that is in outbreak in Simcoe County and declared over. We have a child care center in Simcoe County. We continue making very strong progress on immunization. So at present, we've immunized a total of, or provided a total of 272,000 vaccine doses. So over 253,000 people in Simcoe, Muskoka have received their first dose, making up 42% of all of our residents. And over 23,300 individuals have received a second dose. That's 42% of all of our population, but over 50% of our adult population, 18 and over, have received at least 1 dose of immunization in Simcoe, Muskoka. We have an ever-increasing coverage of vaccination in older people, working our way down into younger populations as our campaign progresses. And so 75% of those who are 50 years of age and older have received at least 1 dose of immunization in Simcoe, Muskoka. And if we look at those that are 80 and older, 92.8% of those have received their first dose of immunization. We are working very hard with our 1 provincially declared hotspot, Bradford, West Gwillimbury, and they now have exceeded the vaccination coverage for Simcoe County. 43.2% of that community's population have received immunization. as opposed to 40% of Simcoe Muskoka, the rest of Simcoe Muskoka, excluding Bradford, West Gwillimbury, for the purposes of comparison. If we look at the adult population in Bradford, West Gwillimbury, 56% of those 18% and over have received at least one dose. If we look at our dashboard, which is a tool we've been using since before the province had its colored framework, we remain in yellow status as we were a week ago. And this includes yellow status for virus spread and containment due to the fact, even though we are improving on our incidence of cases, it's still relatively high. And by the old provincial framework, anything above 40 would put you into the red zone. And we have 57 cases per 100,000 population per week. In terms of laboratory testing, we remain in yellow status because our percent positivity is still quite high at 5%, down slightly from 5.2, and otherwise doing well for the turnaround time for testing at the goal being a 2-day turnaround time. 60%, actually 1 day and 2 days. So 60% of tests to come back within 1 day and 80% to come back within 2 days. And we are meeting that objective. In terms of health system capacity, we remain in yellow. So acute care bed occupancy is within target at being less than 90%, and we are at 71.9%. And ICU bed capacity is at yellow status at 83.6%. Those on ventilator in red status at 70.4%. And in terms of the public health system capacity, we remain in yellow in that we are achieving our goal now of reaching all of our cases, 90% of our cases within 1 day, so 92.9%. But what we need to reinstate is a robust response to the contacts, so that we are able to build up and do again as our case count has come down and allowed us to be able to proceed on that. I'm now able to provide information about hospital occupancy in Simcoe Muskoka. So before I was talking about the numbers of people in Simcoe Muskoka, our population that are in hospital, whether they're in hospital here or somewhere else. But of concern also is the draw on our hospital capacity, whether it's people who live here or people who are transferred here for somewhere else. And so, as I'd indicated, the acute bed occupancy is in good condition at 72%. The ICU bed occupancy is what we call the yellow status at 84%. The ventilated bed occupancy remains at red with over 70% occupancy, as I've indicated before. And to get really specific, we presently have 55 COVID-19 patients in hospitals in Simcoe Muskoka as of May the 16th. We have a two-day lag in our data, but as of May the 16th, 55 COVID cases in our hospitals, and 24 of these patients are residents of Simcoe Muskoka. So the remainder are residents of elsewhere. So just a few things about the vaccine rollout. We have now anyone 18 years of age and older can book on the provincial booking system in order to receive vaccination in our clinics. So certainly that is a milestone for the province to be able to offer this for all adults. I think it's really important for people to know, and I certainly encourage people to, if you're eligible, to book to receive vaccine. But it's important to know that although you're eligible to book, there may be some lag before the date that you actually get your booking. It could very well be in June that you're getting your booking. We are getting a large volume of vaccine, but we've also had a large number of people become eligible to receive vaccine, and we've had a very strong response from our citizens once they've been eligible to book to receive vaccine. All of that is good, but it does mean that it will probably be a lag before you're actually got your booking in, will be able to receive your vaccine if you're booking today. But I certainly encourage people to do that. And another option is for people to seek out immunization via the pharmacies. We have an ever-increasing number of our pharmacies that will be participating in immunization, the province's immunization program, either with Moderna vaccine or with Pfizer vaccine. By the end of the month, all of the pharmacies that were participating in our universal influenza immunization campaign would be online receiving vaccine to provide in the program. Also, we are participating in the provision of immunization via family practices. So we will continue to receive Moderna vaccine to provide to family practices so that they can identify people that they would invite to be booked to receive immunization. So I would recommend that people await a call from your family practice, not call your family practice about that. Also, I would note that in Bradford, West Gwillimbury, which is our designated hotspot, we are providing immunization, of course, to everybody 18 and above who lives in Bradford, West Gwillimbury, but now also people who work in Bradford, West Gwillimbury, and they would be able to book on the booking system that we have via the municipality's website. So I would invite people who fall into that category to make contact and seek immunization. I would also note that more people are eligible to receive a second dose of immunization earlier than the 16 weeks it was communicated from the province. So the great majority of people still fall in the category of waiting 16 weeks. And we do know that there are people that are concerned about having their booking for their second appointment. There are people who had a booking prior to March 17th who don't have a second booking at this time and aren't able to book on the provincial website. We do anticipate by the end of May that the province's website will be able to accommodate a second booking for those people, but right now it technically is not able to accommodate that. So as a health unit, we've got the contact information for those people, and we'll be notifying those via their email when they would be due to receive their dose before 16 weeks and arranging for them to be booked to do so. And are putting out emails to that end to inform these people of this. For those who have had their first dose at a pharmacy or primary care provider, you would need to follow up with that location where you received immunization with regards to a second booking. The Victoria Day weekend is coming up, and we have made, as a province, good progress recently in bringing down the case counts and bringing the third wave under control. But we have a long way to go before that's done. And certainly we want ongoing success going into the summer, both to protect people, but also have a much better quality of life in the summer. And we need to continue to abide by the stay-at-home order and the shutdown order. And I know that through the holiday weekend, this could be particularly challenging for people. But I think it's important that people keep it in mind and abide by it. So with good weather, certainly going outdoors with other household members or on your own is a very good thing. It's good for your health and well-being. If you are in close contact with other people, and in particular indoors, such as doing essential things such as shopping for food, you need to be wearing a mask and doing all you can to keep physical distance from people 2 meters apart. And people need to continue not to have others over to their homes. There really is a 0-person gathering limit right now. We are not to do gatherings with people outside of our household, the only exception being individuals who live alone, in which case they could choose one other household for that kind of close contact. But otherwise, we're not to be gathering with people outdoors and certainly not indoors, where the risk would be much higher. So not having people over into your home, not going into other people's homes is essential. And staying close to home is essential. So traditionally, 24th of May weekend is a time where people like to travel. And I would say for those who have a secondary residence, such as a cottage, with the stay-at-home order, I would strongly recommend that you choose what your primary residence is at this time, and you stay with that primary residence rather than going for a short period of time to the secondary residence. That would be in keeping with the intentions and the safety associated with the stay-at-home order and keeping the pandemic under control and helping to avoid the transmission of COVID from a higher incidence location to a lower incidence location. We, in the past, have seen an increase in cases associated with holiday weekends. And so it's important that people take to heart this message to avoid that from happening to themselves and to their loved ones. So at this point, I'd be happy to take questions.
Thank you so much, Dr. Gardner. As always, we encourage one question and one follow-up to ensure that there's time for everyone to participate this afternoon. And just a reminder to mute and unmute yourself. Can we start with Chris Simon from the Barrie Advance? Do you have a question today?
As always. Hi, Dr. Gardner. Just curious, I know you spoke last week a little bit about AstraZeneca being removed, but has any more thought gone into how its removal affects distribution of the vaccine in Simcoe, Muskoka?
Well, I would say that we're very fortunate to have an ever-growing, strong supply of vaccine. Certainly, Pfizer has always been the foundation for that, and that continues to grow. Going into the first week of June, we expect even a larger shipment per week. The vaccine that was supposed to come next week is actually coming late this week as well, so moving it a little earlier. Moderna vaccine has become more stable as well. So we're very fortunate to have those vaccines coming. And if in fact it continues in that direction, I think we'll do very well indeed with regards to carrying through the summer, providing everybody who we can manage to convince to receive a vaccine to receive it and to get their second dose as well, possibly late in the summer or into September. In that regard, I think we're doing well. The province has managed to change things so that primary care and pharmacies are participating in immunization, primary care with Moderna and pharmacies with Moderna or Pfizer vaccine. So the AstraZeneca that they were getting has been replaced by those other two vaccines. The outstanding question, I think, would be what approach should be taken for those who received AstraZeneca as their first dose, and whether they should receive AstraZeneca as a second dose or whether they should have a substitution, perhaps Pfizer. And that question has yet to be answered by the province or by the National Advisory Committee on Immunization, but we do expect an answer soon on that.
And you had also mentioned about 18 plus being a milestone for the province, but for you, how does it feel to see that happening? It feels kind of like we're in the home stretch, does it not?
It is satisfying. It is satisfying. I always want to manage expectations so that they're appropriate. And so the expectation I would want to manage is how quickly people can book and get their immunization. They're allowed to book today, but they might not have a booking until into June. So that's an important takeaway for people. I would want them to understand that. We do have, a waiting list approach. So people can every day, if they wish at 8 o'clock, book themselves to be on the waiting list for the end of the day to take up the spots for the no-shows. And they do have the opportunity to also seek immunization at pharmacies or primary care. And I would encourage people to seek out opportunities and get vaccinated as soon as they can. But to me, it's gratifying to be at the position now where we're saying it's all adults that we are booking and lining up to receive vaccination.
Thank you.
You're welcome.
Erica Engel from Collingwood Today.
Thank you. Hi, Dr. Gardner.
Hello.
I wanted to ask you, keep saying that you're looking forward to a good summer and we have to do these things so we have a good summer. What does a good summer look like to you?
A good summer for me would be that we avoid a fourth wave, that we manage to bring down the case count low enough that we can start to, certainly open up the outdoor amenities. But also, if we're very fortunate to open up businesses to some degree, such as the outdoor dining and that kind of thing. I don't know how quickly we could get to the point that you're doing more in the way of indoor amenities, indoor recreation, indoor business operations. That I think we would need to be very cautious about, and indeed you'd need the rate of transmission well under control and high rates of vaccination to be more assured. And even then, I think we're going to need for an indefinite period of time, distancing and mask use. We need to be very, very cautious. But one of the great opportunities we have with summertime is summer weather and the ability to enjoy ourselves outdoors. If we can get to the point where we can allow something in the way of social gatherings outdoors with reduced transmission, I think that would go a long way to improving our quality of lives and our mental and physical well-being.
Thank you. There have also been some politicians, I believe from Simcoe County even, calling on the province to open things like golf courses. I've had some residents here want things like boat launches open, so outdoor groups, outdoor activities with lots of space. I'm wondering what you think about those calls to the province to open those activities.
Well, I think it's understandable that people would want that. Those are enjoyable things. This is the time of year in which it becomes much more attractive to do those things, time of year that we're traditionally beginning to do those things. We know that outdoor activity is much safer than indoor activity. We still would be recommending distancing from people who like 2 meters from people who aren't your household. So you'd have to take into account, how do you do that distancing when you're doing those activities? And there's potential danger points related to those activities, like carpooling to get to these spots can be a danger for people that are not from the same household. Or some indoor amenities associated with them, like clubhouses, I think would need to stay closed if they were moving in the direction of opening those things up, to make it very clear to people that the indoor environment and gatherings indoors would remain hazardous. So I can see why people want this. I think we would have to move towards it in a very careful way with the kind of considerations that I've just cited. And I guess from a health unit point of view, we would want sufficient notice from the province that we could be well prepared to support businesses with education enforcement and knowledge, tools, information on our website to be able to do our job well so that it's done in a safe way.
Thank you.
You're welcome.
Mary Beth Hartwell from Muskoka Region, do you have a question?
I do, actually. Hello, everyone. Dr. Gardner, we had received an email from a fella who is basically a shut-in, and I was wondering, even though we're opening up for all adults, what do you do for people that don't leave their house or have difficulty leaving their homes?
Thank you for that question. They certainly are an important group for us to reach, and we've done outreach to many people in that situation, ourselves as a health unit, working with paramedic services in Simcoe County, District of Muskoka, with some family health teams, or our community health centers, in order to take vaccination to their homes. Home care services take vaccination to their homes in order to provide them with immunization. And so when we hear of individuals that fall into that category, we offer to them a way to arrange that.
Okay, great. Thank you. So if there is someone in that situation, do they just reach out to the health unit then?
And we would look into how it could be arranged.
Okay, perfect. Thank you.
You're welcome.
James Bowler from Cogeco.
Thank you. Dr. Gardner, just kind of a two-part question here. So we've had politicians speculating about, how things could get back to normal. First of all, not a politician, but Dr. Williams saying, June 2nd, if we're below 1,000 cases in Ontario. And then, of course, Trudeau is saying we have a normal summer with 75% of people vaccinated. How realistic are these numbers, do you think?
I think we need a clear framework for this province now going forward about exactly how we will open up. The federal government's framework is, I think, a very high level, broad framework. And it wouldn't be binding in any way, whereas something from the provincial government would be more detailed and binding, and therefore, I think, provide more clarity as to what the steps are, what are the indicators that would trigger when we can move to the next step. I would advocate that it would include measurements of disease transmission, like the weekly case count per 100,000 population, and other indicators of transmission, as well as the ability of the healthcare system to cope if you had a resurgence again. So a number of cases in the intensive care unit for the province, and vaccine coverage rates. I think that's a really key thing now, is to tie opening up with vaccination coverage, considering just how important that is to bringing the pandemic under control and keeping it under control. And I think we also need an approach that is geographically broad, so much broader than a system, the system that had been based on the individual health units and their status, that unfortunately led to movement from locations that were shut down to areas that were still open, resulting in transmission in those areas. We need much bigger geographic areas that are covered in a single step at a time to go forward this way. So to me, we need that framework. We need it communicated so everybody knows what's expected in order to be able to, I think, satisfy people's understanding of what it would take to safely open.
So just as a follow-up, with the number of tests becoming sort of a moving target here, completed each day, it seems like 1,000 cases per day is not really realistic in terms of showing the actual story of what's happening. Would it be better, and I guess would you be advocating on behalf of letting each health unit decide on when and how they should be reopening?
And I would argue the opposite. I think we need a much bigger geographic areas than single health units. And I would suggest that also 1,000 cases in the province per day is far too high. I believe the chief MOH really alluded to much less than 1,000 cases. 1,000 cases a day is what we had when we opened up in February, and I'd indicated at that point that it was too soon, that the transmission rate was too high. So I would be concerned if we open up at 1,000 cases.
Thank you.
You're welcome.
Mike Arcelides from CTV Barrie.
Good afternoon, Doctor.
Good afternoon.
What is driving cases right now? Is it still those clusters? Is it still folks who are saying, to hell with this, it's nice outside, I'm going to have some people over for some pops, as our premier would say?
Well, we do have household clusters, and sometimes they're familial family clusters and gatherings beyond the household of family members. But we also have households where there's a large number of unrelated young people living together for education purposes or for work purposes, and they can be quite vulnerable. You can have a large number of people affected in such households. It can be up to 15 people living in such a household. And that's a vulnerable situation that we've seen play out repeatedly through the pandemic. And we still are seeing some transmission in work environments. I've noted the number of outbreaks has remained the same in workplaces. Overall, outbreaks have remained the same over the last 2 weeks. And so although many workplaces now are closed, not considered essential, or very much scaled back, the workplaces that remain still have some vulnerability. And from our education and enforcement blitz that happened at the very beginning of May with the Ministry of Labor, we found that there were some ongoing violations that put businesses at risk, such as not having a good screening process for their employees about their symptoms, or not managing the kind of crowding that can happen in the lunchroom.
So with this weekend, we might see a lot of folks come up from Mississauga, Etobicoke, Brampton, and the like to Wasaga Beach and maybe dip their toes or walk along the beach in that area. What would you say to folks in this area who are saying we can't even enjoy the outdoors because we're putting ourselves at risk in close quarters with folks?
I would say people need to stay close to home, despite the fact that this is the long weekend and traditionally people have gone elsewhere. They need to stay close to home. That the stay-at-home order really requires them to stay close to home, to only go out for essential purposes. And also that most of the amenities are in fact closed. When it comes to beaches, provincial regulation allows people to move through a beach, but not stay or sunbathe at a beach. And so I think that would be really telling people that the beach right now is not a place for people to be going to for the kind of recreation that they typically would have done in past years.
So how long are we going to stay in this stay-at-home order? What's your prediction?
I do know that there's a lot of interest in opening up outdoor amenities. And there's the possibility that you could do that and still maintain the stay-at-home order. That what would be required then is you could use some outdoor amenities, but not with others who aren't from your household. And I guess you could imagine that with a tennis court, for example. It might be more challenging for other things like large team sport locations like soccer fields. So therefore you wouldn't be having games. You would just have individuals and household members just using the space. I'm not sure what it would mean for amenities such as golf. So you could imagine that as a possibility as a first step, that the province might do that. But to go further and really enable the full use of outdoor amenities such as baseball diamonds would really require a lifting of the gathering prohibition that is in place right now. Right now, really, you can only gather outdoors with people from your household, and in order to be able to fully use those amenities, the province would have to be lifting that. And I think we still have a high rate of transmission. I don't think I would be advising that at this point.
Thank you.
Mark Claremont from Muskoka Today. Do you have a question for Dr. Gardner?
Yes, thank you, Mark. Regarding vaccine coverage rates that you spoke to James about a few minutes ago, and I think earlier in your presentation, you said that there was 50%, if I'm not sure, it was the Simcoe Muskoka regional coverage. Where do you think those numbers will be in 6 weeks, given the fact that you said that bookings can happen in May 18th, but may not be received until the June? So where do you think in 6 weeks that number will be up to 60%?
So the 50% figure is of the adult population. Just it's important to know what the denominator is. So 50% of our adult population has received at least one dose of immunization. The province would like to get their coverage up to 65% by the end of May. They are making good progress. I would hope that we're on track with that. And ideally, we need to get the vaccination rate as high as possible. By the end of June, we're thinking we would have been able to reach the great majority of people who would want immunization would have had their first dose by the end of June. And Public Health Ontario had actually identified we need to get as high as 89% of the whole population immunized to achieve true herd immunity. As high as that, it could be lower, but at the high end, that rate. That we can't do without being able to immunize children. So I think that kind of achievement would have to wait till later in the year when there's direction about younger children. I think at a minimum would want 75% of the population covered by the end of June. And I would put that we probably would find ourselves in a position at that point of needing to do more active outreach to those who are hesitant to receive immunization to be able to get the rate up even higher. So we'll need a full-on campaign and awareness campaign and additional outreach to groups, populations that would have lower rates. We monitor our coverage geographically and by age, and we would need to look at to what degree there are pockets that are falling behind, or need to look at other demographics to see if there are particular groups that are falling behind that we would need to address in some way, whether it's with language services or through cultural groups or their faith-based community to help us reach those that are more hesitant later on, late in June and beyond.
Or you could also just advertise with local newspapers. That'd be a good suggestion too.
I've no doubt that media would be part of it.
All right.
Including, and you talk about paid media, probably would turn out to be part of it.
Yeah, well, I hope so. We're all in this together.
Right.
A good segue that you were talking about younger residents there, specifically children there. What is the difference between summer camps for children, and I'm not 100% sure where day camps fit into that camp idea, and traditional schools? Are there any differences? Why can't you have a summer camp, yet you, certainly not right now, you're not having regular day schools there, right?
Mm-hmm. So that's an important and complex question. But at the root of it all is about providing children and youth with positive growth experience, educational experience, something that's good for their health and well-being and mental health. And the camps are certainly more so in the summer. And so all of that is really important. And all of that has been challenged by the pandemic and our need to protect children and the community at large from COVID-19. So we've had a lot of experience with schools since September, and have found a few things. You can greatly reduced transmission with the kind of strict protocols that we've had in place, cohorting to the class, otherwise physical distancing, mask use, screening, enhanced sanitation, and an investigation and follow-up of exposures and outbreaks. So with all of that, we've managed to have a low rate of transmission in schools, even though we've had exposures happening in schools from cases because of transmission in the community. But even despite all of that, we've had to discontinue in-class education throughout the school year because the case count has got to the point that it's gets very difficult to be able to follow up with all of those exposures. So we've had that experience with schools. We're hopeful that we would be able to get things going again, leading to the remaining time, through the remaining time that is the school year before you get to the summer. But we wait upon the province to make that decision. And we give that advice to the province that we would support this if the province is going to go ahead with this. Summer camps, we did not have the experience last year with overnight camps. We did have experience with day camps. We were able to do day camps successfully. The transmission rate last summer was very low. I don't know if we're going to get to be that low this summer. I think we'll be challenged to be able to get that low this summer. But then again, we do have the immunizations, and it's going to include those that are 12 and above in the month of June. That'll add some protection for older kids anyway, older children, not the younger ones who typically do the day camps. But we do have that experience, and so we shall see. The Premier is committed to camps starting, but I think we have to see how things go. I certainly am supportive of being able to do camps if we can do so safely, reasonably safely, because it's so important to their well-being. Overnight camps would be a new experience for us. We didn't have them last summer. They're more like congregate settings in that you've got kids bunking in the same cabins together and eating in large groups together and doing communal activities together and canoe trips, other trips together. Some of the camps have vulnerable children that might have health conditions. So the potential for, say, an outbreak at such a camp certainly would exist. And if you had an outbreak at a camp, then it's in a remote location potentially and that much more challenging to manage. So the province just put out a protocol that we received and are circulating to our camps about how to operate overnight camps, and it does have the kind of content that I would call for strict small cohorts of children so that you limit any spread to single or small groupings of children, and screening and the called upon quarantine period before they go to camp, so they're less likely to bring COVID to the camp. And an approach for the management of outbreaks, the use of masks and sanitation. And so it won't be just as school changed as an experience for children. So camps will change, not be the same as what they were in past years. I'm hopeful that we'd be able to proceed with camps. I know what the Premier has said, but and having protocols is certainly a critically important point to be able to do it. But I think we need to take things one step at a time with this pandemic too.
Great. Just quickly, are you a golfer and are you looking forward to getting out the links soon?
I do all kinds of outdoor activity, but I don't golf. I do a lot of hiking.
Okay, thanks.
You're welcome.
Do we have any questions from the phone line today?
Hi there, it's Ian from Barrie 360.
Hey, Ian, go ahead.
Hi, Doctor. I'm just wondering, I know when we talk to people, there's a lot of expectation looking forward to June 2nd that the stay-at-home order may be lifted. There's even some impression that, the doors are going to swing wide open. What is your hope or would you like to see it extended, or do you think we could go back to a color code frame like we had before, red, gray, and et cetera? It's not going to be, a free-for-all once the stay-at-home is lifted.
We need to be cautious. We will end up with a fourth wave extending through the summer if we're not cautious. And so maybe we'll need to extend the shutdown, stay-at-home order beyond June the 2nd. But for sure, what we need in the near future is the release of a framework about how we will reopen with the kind of content that I alluded to earlier today. And I think that it should not be the same as the framework that we had before that was based on individual health units and their local experience. I think we need much bigger geographic areas, potentially the whole province, but if not that, then much larger geographic areas so that you don't get the kind of migration of people from areas that are more restricted to areas that are less restricted, resulting in transmission.
And is that maybe even a bigger concern because naturally in the summertime, people tend to be on the move, whether it's camping or exploring the province?
Population movement is part of the transmission dynamic of the pandemic. I think it's more of a concern, considerably more of a concern with regards to indoor environments. So, the fall, the winter, the spring season, for when there wasn't shutdowns and businesses were open, then people would be able to become exposed in a variety of venues that were indoors. And when you had differential application of that with some areas in the GTA that were much more restricted than others, you had the potential and actual movement of people from those areas to neighboring areas where it was open and they could go shopping in malls, for example, that led to a greater risk of transmission in those areas. So the indoor environment certainly is something we'll need to be very careful about through the summer. Outdoor environments are safer. I would still think we need to be careful about a movement of people. I think at this point in time, it's important that people stay close to home. Potentially later in the summer, if and when disease rates come down, and we have the kind of framework I'm talking about in place, we can look at how much freer we could be about movement through the province. But we'd always have to be careful about indoor exposures to a greater degree that will be the concern.
Thank you very much, Doctor.
You're welcome.
Are there any other questions from the phone line today? Okay. And is there anyone who has not yet had the opportunity to ask their question? Okay. Well, I think that concludes our media briefing. Next week, just a reminder that our media briefing will be held on Wednesday, May 26th. And thank you so much, Dr. Gardner, today. And thank you for all those who participated.
Bye, everybody.
Thank you.